Okay, hello everyone. Today we have Eva Lim. She's a recent graduate from the Master of Public Health program at Queen's University. And because this week we're going to be talking about the applications of epidemiology in public health and population health. So I thought it would be highly relevant to have someone who just graduated from the program and who is just getting ready to get into the job market. So welcome Eva Lim to our, I guess, podcast or class.
Thanks.
Yeah, yeah,
um,
yeah. So this week, our students will be learning about, why epidemiology is useful in informing public health. So I'm sure you have lots of experience. Your learning is very fresh right now. So hopefully we can have a really fruitful conversation today. So to begin, can you give my students a sense of who you are in any way you like?
yeah, so hi Young, and hi everyone else. My name's Eva, and I was born and raised in South Korea and moved to Edmonton, Alberta at the age of 15 for the education. And I have Bachelor of Science, majoring in medical track biology at Burman University. And after a few years of working as a research assistant, I recently graduated from Queen's University with the Masters of Public Health, as Young just mentioned. And beside work, in my free time, I spend my time gardening, cooking, and playing a golf.
Nice. You have very interesting and sounds like fun hobbies.
Thank
Um,
you.
yeah, okay. How's your gardening going?
It's going good, but I
Yeah.
think I have a bit of love and hate relationship with the squirrels in my backyard. So just the problem that they like my potatoes and everything else as much as I enjoy. That's just a bit of a problem, but everything else
Right.
is good.
That's awesome. Okay, so like I said, you recently graduated from the Master of Health, Public Health program at Queen's University. So can you tell us about your experience being in the program? And I know that you took epidemiology course as well there. So can you share your experience and learning that you have gained in the past year?
Yeah, so I'll just begin with like how I became interested in public health because that's
Mhm.
I took a long way to get into Master's of Public Health, and then there was a bit of time considering which courses that I need to take and stuff like that. So
Mhm.
I became interested in public health while working as a research assistant for various population-based research projects, and I started to notice my passion to learn more about the practical elements of the public health and opportunities to improve population health by preventing illness and managing the illness. So this is when I started to look into the master's program where I could further develop my skills and knowledge in public health. So doing some research, there were two options of master's program that I considered. And one was Master's of Science in Epidemiology, and the other one was the Master's of Public Health. And then these two are often the courses a lot of Bachelor's of Science degree students take into consideration. So I've noticed that Master's of Science in Epidemiology is considered more of a academic degree that focus on research methods in public health, whereas the MPH, shortened as Masters of Public Health, is considered more of a professional degree, allowing students to gain competency in broad-based area of public health practice. So as I knew that I desired to reinforce my skills in searching for evidence-based research, context, and experience, and moving into the action to prevent disease and improve population health, I decided to apply for MPH program.
Right.
So yeah, so when I applied to MPH program, I was seeking to narrow down which stream of the public health I was most interested in. And the Queen's MPH program stood out to me as it was all encompassing from health policy to epidemiology to global health, and but also allowed for the opportunities to explore diverse and more specific topics, so like health economics, health programs evaluations, and evidence-informed actions, Canadian health systems, and chronic disease or infectious disease epidemiology. So
Mm-hmm.
these courseworks really were designed for students to experience the practice the real life career tests. And then these tests could include like health program evaluation, briefing notes, evidence brief, case reflections, and health equity impact assessment.
Mm-hmm. So yeah, so you gave us a really great overview of the of two programs. One is epidemiology, the other one is public health. And
Mhm.
some of the introductory courses, I'm sure you have both students in the same course. For example, I guess epidemiology course. So what were
Yeah.
your experience? So public health is more focused on like kind of practice oriented um, uh, curriculum, whereas epidemiology is more methodological and more, science-based, more, degree-based work. So I'm wondering what are the career options they have.
Yeah, so for the career options for the MPH holds actually a variety of numerous career options out there. So
Mm-hmm.
looking at the MPH alumni's career path, which is also available on Queen's MPH website if a student wants to take a look,
Mm-hmm.
they work as healthcare administrator and biostatisticians, epidemiologists, research analysts, and public health project manager, and like disaster management specialist, public health promoter, which you can also do it with Masters of Science in Epidemiology, but
Mm-hmm.
it is still more focus and experience. And then there's more opportunities like practicum placement are available for the
Mm,
public health programs.
right, right. Yeah, that makes sense. So, I know that you're currently looking for a job. So, what kind of jobs are you looking at? Like, what kind of organizations are you looking at to see, if any jobs available?
Yeah, so I forgot to mention about the practicum placement component of the Masters of Public Health program, which is like one of the huge
Mm,
deal as it gives opportunities to students to really integrate the opportunities to use those knowledge that you learned from the courseworks and then to experience what the field experience is like.
mm-hmm,
So from that practicum placement, I've really learned that I have passion for community health promotion. So I'm currently looking into positions like health promoters or even public health planners. And
mm-hmm,
these job opportunities are available in hospitals, universities, government
mm,
agencies, like
mm-hmm,
regional, provincial, and federal level. And
mm-hmm,
then there's also like pharmaceutical companies as well, where they carry like community health promoters.
right. So, in our course, one of the course contents that I put extra emphasis on is that epidemiology informs public health practice. Of course, there are other things like risk perception, prioritization, and also political will, etc., and political climate as well. But can you just briefly explain how public health practice is informed by epidemiological evidence?
Yeah, yeah. So as public health issues are quite complex,
Mm-hmm.
which also requires complex collaborative solutions, changes
Mm-hmm.
to health-related structures like systems, policies, and environments are
Mm-hmm.
facilitated through these various decision-making process. And then
Mm-hmm.
this is where the epidemiological evidence is utilized.
Right.
So from your course, I know I did the lecture on the 5 stages of how epidemiological evidence is used to inform public health. And maybe I'll just explain by giving example of an issue of maybe high prevalence rate of obesity among kings and adults to better explain the concept.
Sure.
So, okay. So if there is a issue of the high prevalence rate of obesity is detected among Kingston adults, for example, then we first need to look into the Kingston residents' health status data, which can be utilized to frame the issue, such describes the burden of overweight among this group, as well as the root causes and determinants of this complex issue. Then it's followed by identifying the health issue, which can be improved based on the existing and the most sufficient evidence. So issues like in maybe low physical activity rates among Kingston adults. And then the search, and from the search, appraisal, and synthesis of the evidence, intervention can be developed, and then this intervention can be implemented by the health system governance. So maybe examples of KFNA public health is implementing a bike share or incentive program, which includes like bike share program services and increasing the bike path in Kingston to increase the physical activity among Kingston adults. And then lastly, the intervention has to be continuously monitored by maybe program evaluation to see where if the intervention really increased the physical activity of the Kingston residents. So although this example is not the currently existing intervention, the steps of how the epidemiological evidence is searched, utilized, and informed to public health action is what public health practitioners and professionals can expect as their project task. So as evidence for the effective public health comes in part from the epidemiological studies. So understanding the concept of epidemiology, like determinants of health, data sources, measurement, and study design principles, on top of the utilizing of these evidence into informed actions, are really the key foundation of the all public health related work.
Right. Yeah, so I think you explained really well about how, epidemiology and public health practice are interconnected and they're cyclical. So epidemiology, epidemiological studies, it informs public health by identifying, at-risk populations or health problems in local areas. Then, epidemiological research looking at, the causes of obesity, for example, based on your example, then based on that those causes identified, we can develop appropriate interventions. So for example, physical activity is low among those who experience obesity, then, increasing physical activity could be a viable intervention for that population. And then intervention is implemented, then evaluated, and then epidemiological research monitors the progress of the intervention, and also by re-identifying the health problems, we can see if the obesity issue has been resolved or it still remains as a major problem. Then, I guess that's the way we evaluate. So epidemiological research basically is embedded in all aspects and all steps of, public health practice.
That's correct.
Yeah. Okay.
Yes,
that's good. I feel validated by the public health practitioner.
Well, you're the professor, so you probably have better answers. But that's from the side of where I come from as a master's of public health.
Yeah. Nice. Yeah. So you mentioned that you've just done practicum. Can you share a little bit about what you had to do in your practicum course?
Yeah, so building upon those courseworks that I mentioned earlier, MPH students are required to spend 400 hours of practicum placement, which then provides an opportunity to demonstrate and enhance the knowledge, skills, attitude they learn from the coursework. So, and this also allows you to reflect on and advance your career development as well. So for my practicum placement, I worked as a research assistant for the Reconnect study, which was with Kingston Street Health and the Department of Emergency Medicine at Queen's University. And just a little bit about this Reconnect study is that the research project aims to understand emergency department care experiences among groups that have historically had negative experience in the emergency room. So for this role, I mainly facilitated participant recruitment and survey completion on their experiences at emergency department in person via in-person interview. And this facilitation was occurred at Kingston General Hospital's emergency department and urgent care center at Hotel Dieu and other community partner organizations. So by connecting to these partner organizations like St. Vincent de Paul, home-based housing, and integrated care hub, I was able to foster the partnership with them by making initiatives to discuss several logistics on on-site participant recruitment at their location. So I think throughout the Practicum Placement, they really, it was a nice way to complete my practicum, my MPH program as an accelerated student. And I think overall this practicum experience allowed me to work on like substantive public health issues and explore area of interest and engage in like a professional self-assessment and critical reflection as well.
Well, so it sounds like a very interesting study and much needed study because negative experience among vulnerable population, particularly the street population, it's commonly reported, but there hasn't been no public discussions about the issues we have in healthcare system. So I'm sure you cannot say anything about the result or collected data, but I am excited to see any work coming out of your work.
Yeah, I apologize not being able to share any more details as it's confidential, but I'm also excited for the data analysis and taking further steps from them.
So we are talking about how epidemiological evidence, informs public health practice, but I'm sure there are other things that inform or that guide or that shape public health practice. So can you give us an example of other influencers for public health policy formation?
Yeah, so public health policy is formed by public health professionals following those stages of how evidence is used to inform the public health actions, as I mentioned. However, as the public health issue whose underlying determinants of health are very rarely straightforward and lie within the political, economic, and social makeup of the society, public health policy formation is influenced by a variety of other factors. So, and then this can include like public opinions, economic conditions, new scientific findings, technological changes, and business lobbying and political activity. So I'll maybe use the example of the legalization of e-cigarettes to explain. So despite what little is known about e-cigarettes' long-term health effect, it became legalized in many countries, and vaping quickly became a lot more popular. And this was on the grounds from the e-cigarette may help people to quit smoking, even though it was widely acknowledged that unproved benefits of e-cigarettes for treating nicotine addiction, it's much lower than the risk that e-cigarette may pose to human health. So this to make it clear that risk perceptions and particularly underestimated risk of e-cigarette and overestimated benefits in helping to quit cigarette had an impact role in priority setting and public health policy formation. So, and then this example shows that this risk perception, which holds public opinion, may also been influenced by the e-cigarette industry hugely. So by misleading the public on the danger of e-cigarettes, which probably have made some influence on its legalization by its huge commercial powers and potential political lobbying activities. So overall, this example shows that as much as public health equips and inspires the health professionals to take evidence-based action, decisions affecting the public are highly influenced by other factors, including the perception of risk and interest of the stakeholders as well.
Yeah, so your example is really interesting because I've just finished an undergraduate project on e-cigarette, and you said the things that guided the legalization of e-cigarette is the overestimation of the role of e-cigarette in smoking cessation and underestimation of its influence on human health, like long-term health. But also e-cigarette smokers or people who use e-cigarettes, they're more likely to get into cigarette smoking eventually. So the dual use or polysubstance use, it's really common among, and it's becoming common among e-cigarette users. So yeah, that's a very interesting case report on other things that influence public health evidence, public health practice. Yeah. Nice. Okay, so is there anything that you want to say further about public health practice, or epidemiology, or both, or anything about you?
Yeah, like I've heard that there's many of students who are interested in enhancing their skills and educations in maybe epidemiology or public health, but there are many options out there to further educate. But in the same time, with that being so broad, there could still be many confusions to narrow down the area of interest of the students, which also happened to me while I was in undergrad. So I think it's very important to explore the variety of programs that's available. And although I've only mentioned here of Masters of Science in Epidemiology and Masters Public Health programs, there's still much of variety of options and specializations, like including like Masters of Science in Biostatistics, which is also a fully course-based program, as well as the MPH program. So things like that, there's a lot to consider. So don't be afraid to reach out to administration people or anyone, like a guest lecturer that you have in this course. So yeah.
Awesome. That's great. Thanks so much for coming in and talking to our students, and thanks for sharing your knowledge.
Thank you so much for having me.
Okay, bye.